very warm welcome, friends. I am Dr. Havind Tandon, an orthopedic surgeon. I'll be welcoming Dr. Kapil Kumar, who's a consultant at Aberdeen NHS UK Hospital and specializes in shoulder upper limb problems. Welcome, Dr. Kapil. Dr. Kapil is a highly accomplished shoulder surgeon and has rich experience in treating complex problems of the upper limb, shoulder and elbow. And today, he'll be busting some myths about the shoulder problem. A warm welcome.
Thanks very much, Havind. Thanks for the welcome. Indeed, a pleasure to be here.
So, Kapil, I'll be going through few questions, and please share your rich experience regarding the problems, and especially in India, we have some myths associated with shoulder issues.
Sure.
So in your practice, which are the common myths that you face from the patient and families regarding shoulder problem?
I think the biggest myth that you face is not just from the patients and families, but from other clinicians as well, where a broad label of frozen shoulder is applied to a number of things. But as you and I both know, that a frozen shoulder is a very specific condition of the shoulder, which needs specific investigation, specific intervention, and specific treatment. So I think that is the biggest myth. The other myth which I commonly see from people is, oh, don't get a shoulder dislocation fixed unless your shoulder is dislocated at least twice or thrice, which is, again, we can discuss about it in more detail. And a lot of patients still don't know that you can have a shoulder replacement. Like you can have a knee or a hip replacement. Similarly, you can replace a shoulder as well.
Very well said. So for our audience, for their understanding, in Hindi also, frozen shoulder, जैसे हमारा कंधा जाम हो जाए, डॉक्टर कपिल उसके बारे में वही समझा रहे हैं. ये एक सिम्टम है, ये बताने का तरीका है कि मेरा कंधा नहीं हिल रहा. ये एक डायग्नोसिस अकेला नहीं है और बहुत सारी चीजें इसमें संगठित होके करेक्ट डायग्नोसिस के बाद ट्रीटमेंट मांगती हैं. Am I right?
Yeah, I think you're right. But as I said, कि हमें फ्रोजन शोल्डर का लेबल जो है वो हर कंडीशन को नहीं लगा देना चाहिए. एक फ्रोजन शोल्डर एक अपने आप में एक अलग ही कंडीशन है और बाकी जो चीजें हैं वो अभी जो और भी लोग हो सकता है कि इस बारे में पता हो कि कभी किसी को रोटेटर कफ की प्रॉब्लम हो सकती है, किसी को इम्पिंजमेंट हो सकता है, किसी को आर्थराइटिस हो सकता है. सो कंधे में दर्द के जो कारण है वो बहुत सारे होते हैं और उसकी जो इन्वेस्टिगेशन और ट्रीटमेंट है वो बहुत ही स्पेसिफिक होती है उस चीज के बारे में और इलाज भी उसी तरह से किया जाता है.
So, Kapil, I would like you to slightly elaborate more on the three things which you specified just now. Frozen shoulder, क्या investigation, क्या follow-ups, impingement जो आपने word use किया, and rotator cuff tears.
Yeah, so what I would like to do is probably bring impingement and rotator cuff tears as the same problem. And I will try and explain to you why I say that. So सबसे पहली बात है कि हमें पता होना चाहिए कि रोटेटर कफ है क्या. What is rotator cuff? So हमारे कंधे में दो लेयर्स हैं मसल्स की. एक तो बड़ा जो मसल बाहर है और then there is an inner layer of muscle जिसमें कि चार मसल्स हैं. That is collectively called the rotator cuff. And its main role in life is to help move the shoulder by keeping the ball of the shoulder stable in front of the socket. That helps the big muscles to move the shoulder. Now, due to any reason, this rotator cuff may not be working very well. Common thing is, if you do a lot of repetitive overhead work, it may cause fatigue and tiredness of the rotator cuff. But also, beyond the age of 40, 45, the tendons and muscles are not as strong. So it may not be working very well. So इसका जो सबसे common symptom होता है impingement syndrome का, कि जब पेशेंट अपने बाजू को उठाने की कोशिश करता है तो उनको दर्द होती है, which is called as a painful arc. तो वो कंधे के ऊपर ले जाने में उनको दर्द होती है और उस कंडीशन से वो they are unable to do overhead activities, anything that involves lifting their arm up. washing their hair, dressing, undressing, that becomes difficult. And sometimes they get pain through the night as well. But classically, the pain is not over the shoulder here. It is more along the upper arm. That is why a lot of people do not diagnose it properly. So if you think about it, ये जो constant एक friction हो रही है rotator cuff की, now that may lead to a tear. जैसे अगर आपके पास में एक रस्सी है, अगर आप उसको घिसते रहें तो रस्सी जो है टूट जाती है, तो उसी तरह से rotator cuff tear हो सकता है. Sometimes a rotator cuff tear can happen if there is an acute injury to the shoulder. So the investigation, the first line of investigation is that you need a careful assessment by a doctor, an orthopedic surgeon, or a very skilled physiotherapist who can diagnose the condition. जो investigations जिनकी आपने बात करी, the most common investigation that we do for this, apart from an X-ray, is that we do an MRI scan. तो MRI scan जो है, वो हमको ये बताता है कि is the rotator cuff intact or is there just a problem. Sometimes the MRI scan may show that there is what is known as a partial thickness tear or a full thickness tear, and then we tailor the treatment according to that. So common modalities of treatment agar aap puche, so physiotherapy is very important, but again physiotherapists have to understand the problem and do appropriate, so again special training for those physiotherapists. The other issue is sometimes they may need an operation, but before that we always try a steroid injection into the shoulder along with physiotherapy, and that can cure most patients with impingement syndrome. Surgery is needed in a very small percentage of people. Rotator cuff tears will need surgery, especially if they are large tears. So I hope that makes a little bit clarifies the issues about
absolutely helpful, and very nice that you brought in the overzealous gym exercise. Our people in the younger age, sometimes to have beautiful rippling muscles, they start pumping iron or doing exercises a bit too vigorously, too strongly. And in the way you have just described and explained, that should be discouraged, especially in case of you are having any episode of pain in the shoulder.
Yes, and also while you're talking of exercise, it's also unbalanced exercise. A lot of youngsters are doing a lot of exercise like bench press, and they're just focusing just on the front of their body and not focusing on the back. So you must have your shoulder in balance. And that brings us to another common issue, underlying problem that may cause impingement is posture. जो हमारा shoulder blade है, scapula है, वो हमारे shoulder का basis है. और अगर आपकी scapula
you started answering my next question. I was about to come to this, that especially people, we are using a lot of gadgets these days, and we are on some sort of a device typing and using. So what in your advice would be the right thing to do?
So one is, when you are working at your desk, make sure the height of your desk and chair is appropriate. If you are working on a computer keyboard, make sure that your computer keyboard is not too far away, that you're not leaning over your desk. So those adjustments have to be done. Now, since COVID pandemic, a lot of people have been working from home, which means people are sitting on their sofas with their laptops in their laps. That is a real, I would call it's a shoulder killer, because उसमें क्या हो रहा है कि you are just hunched over like this, और जो shoulder blade है that tilts forward and it causes impingement. So if your work is sitting on a desk for a long time, please get up, walk around, do some shoulder exercises, look at your posture when you're working, and make sure that you're sitting in an ergonomically designed desk and chair in your workstation. So I think that is very important.
I think in our school days, our physical examination teachers, education teachers used to always keep on saying, brace back your shoulders. So that is effective.
It is very effective. And if you look at that, in the past, there used to be what were called as finishing schools for young ladies, which said, head held high, shoulders back and back straight. It was not just for elegance and poise, there was a lot of biomechanical sense there. The moment you pull your shoulders back, not only your posture improves, but you're pushing less strain on your shoulders. So it's very, very important to remember that. And again, just a little message for the young gym goers who are pumping iron. Yes, work on your deltoids and work on your bench press, but don't forget that you've got a back as well. Otherwise, your shoulder will start giving you trouble. So focus on that.
So besides the young recreational athletes, we also would be having the domestic, the workers at the home front, the young mothers, and they have to go for shopping and they have to carry a lot of purchases. So that also causes a little drag effect. What would be your advice?
Don't carry too much heavy things. Balance your load on either side. And if you can get some help, do that. But I think it's the imbalance that is causing that problem. But again,
Right.
the other issue is driving. When we are driving, especially if you're on a long drive, if your seat is too far away from your steering wheel and you're leaning over with your arms, that is going to cause you shoulder discomfort. So again, try and keep your seat closer to your wheel so that you're not sort of leaning over, but you're sort of sitting back in your seat and holding the wheel properly. So again, those are the things.
So you mentioned that the first line of managing a shoulder related issue is a good history, a careful examination by a qualified physiotherapist or if possible, a shoulder trained doctor.
Yep.
This would be followed by good set of corrective exercises of posture, corrective strengthening of the shoulder, rotator cuff and other muscles. And if required, some medicines by mouth. Still required, you might give a shot of a steroid injection into the shoulder.
Yes.
Say, Kapil, these things are not working. What should be the next step? Because that is where the roadblock in India starts. That everybody, especially these are patients who are middle or senior age, and the usual myth is continue the physiotherapy. 6 months से 1 साल लगेगा, shoulder ठीक हो जाएगा. But if there is a rotator cuff tear, वो कैसे ठीक होगा? So put some light on this.
Yeah, I think that's a very, very valid point. So that is why I said we need to differentiate between what is a frozen shoulder and what is an impingement or rotator cuff problem. अगर आप ये कहें कि किसी का frozen shoulder है, तो यस वो ठीक हो जाएगा, 1.5 साल में वो अपने आप से ठीक हो जाता है. बट वो 1.5 साल मुश्किल होता है क्योंकि उसमें पेन बहुत होती है और स्टिफनेस बहुत होती है. So let us leave that frozen shoulder aside, but let us talk of the impingement and rotator cuff problem. Now the reason you're getting impingement is, so impingement to agar English mein, if we translate it, it means that something is being pinched, something is being obstructed, something is pressing on something. So here the rotator cuff is being pressed between two bones, and if that continues, it may eventually lead into a tear. So we have to act. And let's say you've done oral medication, physiotherapy, injection, आपने injection लगाया, इंजेक्शन के महीना 1.5 महीना आपको अच्छा रहा, उसके बाद में फिजियोथेरेपी के बावजूद आपकी दर्द फिर से हो रही है. सो देन यू स्टार्ट थिंकिंग कि आप एक और इंजेक्शन लगाओगे या कुछ और करोगे. You can try another injection if one injection is given you good relief. But if not, then the solution is not a very difficult, small keyhole surgical procedure called a subacromial decompression. In that we go in. Usually you can, on an X-ray or a scan, you might find a small bony spur which is rubbing into the rotator cuff, and it is best that we take that spur away. We clean up all the pain-generating tissue, and that way we are preventing further damage to the rotator cuff. We're relieving the symptoms, and as I said, it's a small arthroscopic keyhole surgery. You get 2 or 3 little puncture wounds about the shoulder, and the recovery is much quicker. So if non-operative treatment done appropriately has not worked, then surgery has got a definite role.
So,
but if there is
a common man understanding, अगर आपके जूते के सोल में कील निकला हुआ है, वो एड़ी में चुभोगा और नासूर बनाएगा ही बनाएगा. जब तक आप उस कील को हटा नहीं देते, आपका एड़ी नहीं हील करेगी. सिमिलरली इन द शोल्डर, अगर वो हड्डी की चोंच है जिसको डॉक्टर कपिल ने इम्पिंजमेंट सिंड्रोम बोला, ऊपर वाली हड्डी जिसके बीच में से एक गैप होता है डोरिया चलने का, वहां अगर हड्डी का तीर बना हुआ है, जब तक वो एक छोटे से दूरबीन के ऑपरेशन से घिसा नहीं जाएगा, साफ नहीं किया जाएगा, आपका शोल्डर ना दर्द जाएगा और उससे आपका रोटेटर कफ जो खराब हो रहा है पूरी तरह से छिच के टूट जाएगा. So, Kapil, you must be seeing a spectrum of these patients who got ignored, did not take correct time treatment, and they finally landed up with a drop arm. कि अब वो अपना बाजू रोक भी नहीं पा रहे, and they are in slightly senior age. So, what are the options of treatment then?
So, the most common reason for a drop arm, as you say, drop arm mean कि आप अपना बाजू पर उठा नहीं पा रहे हैं, अगर कोई उठा दे तो वो गिर जाता है. दैट मीन्स कि आपके जो अंदर के मसल्स हैं, विच इज द रोटेटर कफ मसल्स, वो नहीं काम कर रहे. सो दैट मीन्स यू हैव गॉट अ लार्ज रोटेटर कफ टेयर. सो देन वी फर्स्ट एस्टैब्लिश द डायग्नोसिस ऑन एन एमआरआई स्कैन. एमआरआई स्कैन हमें बहुत सारी इंफॉर्मेशन देता है. हमें बताता है कि टेयर कितना बड़ा है, पर टेयर से ज्यादा बड़ा हमें ये बताता है कि जो मसल्स में जो मांसपेशियां हैं उनकी क्या हालत है, जिसको वी कॉल इट फैटी इन्फिल्ट्रेशन. अगर वो मांस की जगह पे फैट बन गया है तो आप उसको ठीक से रिपेयर नहीं कर सकते. तो वी असेस द पेशेंट एंड वी टेक अ लॉट ऑफ फैक्टर्स इनटू कंसिडरेशन. एज क्या है और जो कोमॉर्बिडिटीज कितनी है, स्मोक तो नहीं करते हैं, वगैरह वगैरह. इफ the MRI scan and the clinical picture tells you that you can actually repair this tear, then we would repair this tear. In some people, a physiotherapy course for 3 months may improve their function. But if surgery is required, we can repair these tears. But if the patient is an older individual, let's say above the age of 75, above the age of 70 or 75, surgery to repair a large rotator cuff tear is not very successful. The chances of it working in as compared to somebody who's 50, 55, in 70 to 75-year-olds, it is very less, especially if it's a large tear. But in that case, you know, these individuals should not despair. इनको ये नहीं है कि आप इनकी जो है बाजू कभी काम ही नहीं करेंगे. We've got a very elegant solution which is called a reverse shoulder replacement. Now people might think, what is a reverse shoulder replacement? तो नॉर्मल शोल्डर में जो बॉल है वो आपकी बाजू वाली साइड पे होती है और सॉकेट जो है वो अंदर होता है. रिवर्स शोल्डर में हम उसको उल्टा कर देते हैं कि जो बॉल है वो हम अंदर लगाते हैं और सॉकेट जो है बाजू वाली साइड पे लगा देते हैं. एंड दिस इज अ वेरी वेरी सक्सेसफुल ऑपरेशन. इट इज अ जॉइंट रिप्लेसमेंट बट द रिकवरी इज मच क्विकर. वी कैन विद इन द फर्स्ट 6 weeks to 2 months, patients are able to take their arm above their head, and by about 6 months or so, they should have most of their movements back. It is an artificial joint. It is never as going to be as good as the normal one, but it relieves pain, it restores function, and most importantly, Havind, in this group, it is the lack of independence which these patients face.
Yes.
You know, washing their hair, dressing, doing day-to-day tasks. Even in certain people, I've seen that they can't take the hand to their mouth because they're on the strand and the food drops. So वो जो lack of independence होता है ना इस ग्रुप में, वो इस ऑपरेशन से हम रिस्टोर कर सकते हैं. एंड आई थिंक दैट इज वेरी वेरी इंपॉर्टेंट. स्पेशली पीपल आर नाउ healthier, we are living for longer now, so why condemn somebody to a life where they can't use their arm, but this operation is there.
So that's very good information that हमारे पास अब एक रिवर्स शोल्डर सिस्टम है कि बॉल सॉकेट की जगह अब इधर आपका बॉल आ गया है और बाजू में सॉकेट, जिससे आपका मैसिव टीयर्स में भी सोल्यूशन है. कपिल, देयर in India, obviously it's a big country. We have also lots of neglected cases of arthritis, medical arthritis, which might be rheumatoid or other types. We also have another set of patients who are poorly controlled diabetics, which led on to both the frozen shoulder variety as well as a lot of cuffs which got ignored, and now they are having arthritis also between the shoulder. So ऐसे patients जो rheumatoids थोड़े से younger हैं या जिनका because of massive tear problems रहे हैं, कोई और ऑप्शन बिसाइड्स रिवर्स शोल्डर होता है?
देखो, जैसे कि और बाकी जॉइंट्स के लिए शोल्डर रिप्लेसमेंट है, वैसे शोल्डर में भी है। रिवर्स तो इज देयर ओनली फॉर पीपल जिनका की रोटेटर कफ नहीं काम कर रहा है। बट इफ यू गॉट समबडी विद आर्थराइटिस जिसका की रोटेटर कफ काम कर रहा है, वी हैव गॉट एनाटॉमिकल शोल्डर रिप्लेसमेंट करते हैं, यानी कि वी आर रिस्पेक्टिंग द नेचर, जहां बॉल है वहीं पे बॉल को छोड़ दिया, जहां सॉकेट है वहीं पे सॉकेट छोड़ दिया। और अगर आप देखें तो हिप रिप्लेसमेंट में फॉर एग्जांपल हम इतनी बड़ी एक स्टेम डालते हैं उसमें, वैसे ही शोल्डर में भी पहले डालते थे, लेकिन देन वी रियलाइज यू डोंट नीड सच अ बिग स्टेम। सो the anatomical shoulder replacements which are working very well around the world and in my hands, and I've been doing this, using this for more than 12 years now, is what is called a stemless design. So the metal piece is extremely small and you put in a plastic socket, but the metal piece that goes does not go right down your arm. So that is a much lesser invasive operation. The recovery is much quicker. There is very little blood loss, and you don't damage the whole bone. You just replace the part that is needed. So you get very good outcomes from those. But let's say that you are a younger patient जिसका की shoulder stiff है because of frozen shoulder. आपने frozen shoulder की बात करी, तो those patients don't despair as well. With a small arthroscopic keyhole procedure, we can do a capsular release and restore function immediately after the operation. So technology, as it has evolved, has given us a lot of tools to deal with these widespread shoulder pathologies. Shoulder used to be the neglected joint in the body so far, but it need not be, because the expertise, the technology, and the experience is all there.
And very rightly said that shoulder was the neglected joint, and Indraprastha Apollo Hospital, Delhi, has always been on the forefront, providing affordable, world-class care near your place. And we are thankful that Dr. Kapil Kumar has consented to be associated with Indraprastha Apollo Hospital, Delhi, and will be available to take care of our patients and their families and give us the best what is there in the world near your house at a very, very affordable, good cost. So thank you so much, Dr. Kapil, for your time, and looking forward to having more such sessions with you. Thank you.
Thank you very much.